The anterior hip, the inguinal ligament treatment. Many therapists are taught how to work a person's hip flexor area, the iliopsoas. I myself have learned it, and I prefer not to use it. I feel that treatment is very invasive. You're pushing through the side of the abdomen. As the person goes into hip flexion, you feel that muscle pop up, and then you can cross fiber friction it. It's very sensitive on most people. An alternate to that is that I started looking at the fascia that covers the hip area, and I prefer to treat that. It's a two-step process. The first is applying a little bit of pressure to the ligament and then shortening the area. The second part is kind of like a tissue re-education movement. People have commented to me that it's a lot less invasive, although it might be a little bit more time-consuming, and yet the effects are amazing. In the tissue re-education portion, it seems like it kind of reams out the acetabulum, especially with arthritic hip joints. It smooths that ball and socket out. And people that have commented to me that are bone on bone, that have hip replacements, surgeries scheduled, many of them have actually canceled their surgery because of this technique. Have to really utilize your sensitivity and work with the person. I'm honored to be able to show this demonstration video of an actual class of mine. The woman on the table had experienced pain and lack of range of motion for the past 20 years. When she got up from the table after this 16-minute demonstration, she had said that she's gained at least 80% more range of motion in her hips than she had before. Next is the inguinal ligament. This attaches at the anterior superior iliac spine and the pubis. And the best way to find it is just to bend their knee. Where their material creases on their clothing or the drape that's over top of them, you'll know exactly where it is. It's also the underwear line. This procedure can be done over top of a drape, with shorts on, just a variety of different things. And we want to use a lot of sensitivity here. We're only using 5 pounds of pressure maximum. 3 fingers. Anything more than 3 fingers, then you actually run the risk of actually intruding into some really sensitive structures that unless you have specific training on how to work, you're better off not even going there. But 3 fingers, you're perfectly fine. So you won't risk pushing into the femoral artery, the femoral nerves, sensitive lymphatic vessels. But 3 fingers, you're perfectly fine. So from the ASIS, go just a little bit inferior, 3 fingers. You want to try and go into the center of the hip, not as much into the center of the body. The center of the hip, as you're moving the leg around, it'll ensure that you're staying right where you should be. I also want to have a straight palm, because when you bring the leg around in different positions, you're going to run out of room if you have a cupped hand. So you have to have a straight palm, just like Bruce Lee or Jackie Chan. Okay? So go into the center of the hip, straight palm, 5 pounds of pressure max, almost nothing. Because as you move the leg, if you find a tight spot, it's going to actually increase the pressure without you having to do it. So then once you find this spot, 5 pounds of pressure, going into the center of the hip, straight palm, then lift the knee, and this area should actually tighten up a little bit. You should feel it. Now instead of lifting the leg, because the leg literally could weigh hundreds of pounds, so you're going to cup your hand and go just below the knee, the patella, and you're going to push the knee in different positions instead of lifting the leg. Push. Keep your constant 5 pounds of pressure on, and we're going to the mid position here, and just allowing her to get used to that 5 pounds. Doing okay? From here, if I think of the center of the hip kind of like a clock, then I'm going to slowly lower the leg to 9 o'clock. And we're just going to just wait. I could do this on a post-operative hip replacement person, but you have to just be aware of the movements they can't do. They can tell you, their surgeon can tell you, with a lot of anterior approach hip replacements, it's not an issue anymore. But still be aware. So you're working with the person though. If they can't do it, then you can't go there. Some people, geriatrics, have a very small range of motion, baby ranges. But if the person can handle it, take them to their fullest edge. Anything more than 5 pounds, this would be way too much pressure. But 5 pounds is perfectly fine. Then we're going to move the knee up into 10 o'clock position. Try and make sure to let it go. How's it feeling? Is it okay? Little sensitive or not too bad?
Not too bad.
Do you just feel the pressure where my fingers are?
Yes, it burns.
It burns? Okay. So that's kind of released a little, 5, 10, 15 seconds. Go to the next position. 11 o'clock. It's not uncommon that you'll find at least 1 to 2 spots that are really sensitive. So you might want to go back to those spots again. A lot of people comment maybe 11 o'clock, maybe 1 o'clock. So far, so good? So 11 o'clock here seems to be pretty good. Still a little tight, but not too bad. Ooh, little spot there.
I feel my right hip is relaxing.
Is it?
Oh, wait, this one. It
Your
moves
left
it.
hip is relaxing
Yeah.
a little? The opposite hip? Now we'll go up to 12. Oh. So that was really tight. So what I'm going to do is I'm going to back up to about 11:30 and I'm going to slowly creep into that spot. If I can't get to 12 this way, then what I could do is I could go around the other way and then come in from 1 o'clock and see if I can slowly creep into that 12 o'clock spot.
When you say
Go ahead.
tight, you're talking about what you're feeling with the knee in terms of resistance, or what you're feeling with your...
No, I actually feel the inguinal ligament tighten up.
Okay, gotcha.
Yeah, that whole area just tightens right up.
Okay.
Did you feel like a vein just,
Is it better?
yeah.
Isn't it nice though that I take it really slow and I don't go in there too fast?
Right. So you haven't moved your fingers at all, it was just in that same spot?
Yeah, I kept my fingers right there. Now we're going around to 1 o'clock and she doesn't like that one. So we're going to back up a little bit and slowly go in there. Still don't like that spot. Better.
Yeah.
Slowly getting in there.
Oh,
You're making me look bad. Because I said this was uncomfortable, not painful.
I told you earlier it was really bad.
I know. That's why I want to work with you. 2 o'clock is not good. Do you notice that I can't get full range of motion? I should be able to get her knee over here. She can't handle that. So I'm not going to push her. I'm taking her to her edge, but I'm not pushing her any further than that. There, too. It's like the whole left side of the clock is non-existent for her. But going right to that edge, just past the midline of that clock, it's tough for her, but she's doing it. She's doing a good job. So that means when we go around again, she's going to have better range of motion just from doing that. How's that? So that's about 3 o'clock.
That burns.
It burns. Do you feel it in the front or the back?
Right there.
Okay. 4 o'clock. Some of the lower positions that you'll go to, like 4 o'clock and 5 o'clock, the foot is actually touching the table. If that's the case, then just unbend the knee a little bit, and you'll be able to get to those other positions. No more than 5 pounds. 6 o'clock. 7 o'clock.
Good.
8 o'clock.
Good. Okay.
And 9 o'clock. So, first part. The second part is just a tissue re-education move of moving the leg to different positions, and it's going to stretch, and it's going to kind of lubricate this hip joint. And it'll get everything. It'll get the leg, the ligaments, the tendons, you name it. So we go to mid position. You sure you're all right? You want to do this? So mid position here, now what we're going to do, instead of just doing that range of motion on her, maybe this probably isn't a bad idea, just doing that. But let's put a little torque to it. So I'm going to pull the knee towards me, and I'm going to push the ankle away from me.
Oh,
So we're externally rotating her hip. So she feels that everywhere. Do you feel it more in the back?
right here.
Right there in the front. So we're going to go down to 9 o'clock. Let it go. There you go. But you see, I'm not pushing it, am I? I'm just holding it there and had her let go. So when she let go, if I would have pushed it, she would have like tightened right back up again. She's like, I trusted you. So let's see, can she go any more? Well, maybe just a touch. Yeah, there we go. So this is probably longer than 5 minutes. So especially this demo too, but the average is 5 minutes. There you go. She's experimenting with it. Her body is really tight, and then all of a sudden she sees I'm not going to move or anything. I'm not going to do anything fast or funny, and then she lets go a little bit. It's one layer at a time. So I remember that 12 o'clock spot was not good. So we're going to try and go up a little bit to 10 o'clock. And you want to keep this external rotation as much as you can. And now we're getting into my favorite hamstring position, or stretch, which is called happy baby. So with this one, the person could do this at home. They would take their hand and push down on their foot. And then if they do both legs at the same time, then they look like a happy baby. And it really gets into those hamstrings. You all right? Still there? So we'll go up to 11 o'clock. Try and keep that torquing going. Make it a little easier. I'm actually putting my elbow into my side to give me a little leverage. If you have to, you can get on the edge of the table and just put your body into it.
I was like, gonna get kicked.
She's not liking that 12 o'clock spot. Take it nice and slow. There we go. She's going to feel so good afterwards.
Hurts.
This is like a better back yoga class in 5 minutes. But for her, 15.
Oh,
So we're trying to get to 12 with that external rotation. All right, let's try the other way. So we go down to 6 o'clock with external rotation. So where do you feel that? Front or back? Front.
they're all right there.
Right there. Then we go over
Oh.
to 4 o'clock. Same place? See, if we would have done the other leg, then we would have been done already. She doesn't have this problem with the other leg. That's all right. I'll push it to a point, but not over that point. So you got to find out that we have a communication going on, that she'll let me push it a little, but you don't take it over the edge. There's no way I'm going to take it over the edge. I'm working with her instead of working against her. You're good. You're good. So we're just past the midline. So this... All right, let's go back around again. So give her a break. All right? So next thing we're going to do is the second part of this. So the second part of this is we've already done external rotation. Now we're doing internal rotation. Internal rotation of the hip will get everything else that the external didn't, but the one precaution is the knee. Sometimes the knee, it puts a little extra pressure on that. So keep asking them if the knee's an issue, then you just don't torque it as much. So we go to mid position. I'm going to push the knee away from me and pull the foot towards me.
Keep going.
What's that like?
Yeah.
Wow, you're good at this.
It's still there, but it's better.
Okay. This is hard to do for a lot of, we never do this. So mid position, now let's go to 9 o'clock, nice and slow. Let me know if it's too much. Is the knee okay?
Yes.
Can you just let your hip go? Let it go? There you go.
Oh,
Can we go up with it?
yes.
Okay.
Oh,
No, we can't, unless you let it go. There we go. Do you feel that's still in the same place? In there?
oh, it goes right there.
Okay, is the knee okay though?
Yes, the knee's okay.
Now, if the knee were a little bit too much, well, then you just don't torque it as much as you're going up. Okay, now you did this before, so what we're going to do is, we're just going to go to this position that she can do, then we're going to torque it. It's kind of subtle, but boy, what a difference. It's like she's going to have a new hip when she stands up. I don't think I would call it strain counter strain though. Go ahead.
So you just do this anytime somebody has tight hips or for anything else specific?
Oh, you could do it it's specifically for sciatic pain. If they have tight hips, yes, you could do that. I especially like to do this with arthritic hips. They love this. Sometimes they've even
Oh.
canceled their hip replacement surgeries
Yeah.
because of it. Sometimes the hip will clunk. But the precaution is be careful about hip replacements that have had their hips done, and especially knee issues. If the knee starts bothering them, just don't torque it as much as you're going around. But it's great for arthritic hips. I think she can get to 12 o'clock easier with internal rotation than she can external. What I really want to do is get to the other side of that clock, to that 3 o'clock side.
Did she have an injury to this hip to make it so?
Ooh, she's doing it, all right. Because I can get better on internal rotation than I could with external. Good job. Still feel in the front?
It's going all the way back here.
All the way in the back in the
Yeah.
glutes?
Right here.
Okay,
Right there.
that's great. Okay, you did it. Excellent job.
Good job.